Welcome back to another edition of Ask Dr. George. And now today we're going to talk about how losing teeth can really, your bone loss here in your jaw, it's a thing, right?
Yeah, absolutely. You know, that's one of the things that we talk about with our patients all the time is when they lose teeth, they're going to lose bone. That's one of the reasons why a lot of people have their teeth replaced with implants, is because that's one of the benefits of an implant is it helps retain the bone around where that tooth used to be.
So is that why sometimes when you see older people, they almost look like a balloon, you know, that's not full anymore and just kind of all sucked in? Is that part of that process?
Yeah, what happens with, especially some people who've lost their teeth.
Yes.
And so, you know, once you've lost your teeth, what'll happen is that bone will start to resorb. It starts to move, to go away.
Okay.
And so what I did today was I brought in a few props and some things to sort of show people what I'm talking about. So for instance, you know, up on the screen here, we have a radiograph. This is a normal, you know, adult dentition. This is what it would look like. And so what I want you to pay special attention to, of course, is you can see here where all the teeth are.
Yep.
And then right here is the beginning of the jawbone.
Right there.
And the jawbone on the lower extends down to here. So look at that thickness.
Wow.
Okay, so typically what we're talking about here is that is a normal lower jaw, and then you can see how tall the bone is up in here. So this is the bottom of the sinuses here, the eyes are up in here, and so there's quite a bit of height here of this jawbone. Now let's take a look and see what happens to somebody who's been wearing a denture for 20, 30 years and see what their jawbone looks like. So this is a typical example of what we'll see.
Ooh.
Yeah, and
Wow.
so you can see now just how thin this jawbone has become here. It's very, very thin. She's lost, you know, and look at the top here.
Yeah.
So the eye socket is right here. This height is, you know, this is where that, and the sinuses are sitting here. So all that bone, the bone on the top used to come down to here, and the bone on the bottom used to come all the way up to here. And so you can imagine that this height...
That would explain why your face looks like it's collapsing, right?
It's exactly what happens.
Nobody needs that.
Yeah, your face will totally collapse on you. So this is a problem. This lady came to see me and she wanted me to do something about this. She couldn't wear her dentures anymore.
Okay.
Because there was nothing there to support them.
Okay.
So, you know, what I did, I brought some different models in here today of different situations that we treat here on a regular basis. So, and what I want to just show you all is what I'm talking about. So if you take a look at this model here.
Okay.
All right, so you can see that they still have some teeth in the front and they still have some teeth in the back. But then take a look at this midsection.
Right.
You see how it's hollowed out?
Yeah.
Right? You can see this width here is all gone. So the bone used to actually come out like this.
Isn't that interesting? Look at that.
Right? And
Wow.
so now it's in like this. So this is one of the challenges that we're always having to deal with when we're talking about doing dental implants. People will come in and say, you know, I'd like to put some implants in here, but how am I going to do that? You can see here as well that they've even lost height.
Yeah.
Right? So they've lost height, they've lost width, and so now we have a challenge trying to put some, you know, implants or something in there to restore this.
And that's simply because those teeth were pulled or fell out.
They were pulled, and then over time the bone goes away. You know, it's the adage, use it or lose it.
Okay, there you go.
Right?
Who knew?
Yeah. So if you're not using the bone, it will completely go away. Here's another case here. This young man came to me all the way from Jamaica, and we're going to be reconstructing this front section here, but you can really see how that has really lost bone here.
Wow.
Right? And you can imagine if I tried to put, he's only missing one tooth, right? If you try to put one tooth in here, this is not going to look right.
No, but there's so much damage done just from that one tooth being gone within that jaw.
Yeah.
Wow.
So, you know, these are typical situations that we see. Here I've got some models.
I used to see these just sitting in a jar beside my grandma's bed.
Yeah, right.
There it is.
This is the 19th and 20th century version of how we replace missing teeth.
Right.
And you know, so this is a denture. You know, they work certainly better than gumming it.
Right.
Right. And so a denture, a full denture like this, can replace all those teeth. But what I want you to see here is sort of where the teeth are here, this person still has almost a full jawbone.
Okay.
Okay, so this person would probably get along quite well with their denture versus, say, somebody like this, and you can see here where the bone has resorbed to, all the way up here.
Wow.
So, you know, this part here, this part of the prosthesis, this pink part, that's replacing the pink part that the person lost. So they
bone.
lost the bone and the gums,
So
and
they
so this is all gone now. This is a problem.
Yeah, for sure.
For a lot of patients. So this is an implant model, and it's showing you an example of some teeth that we can do with implants. We're going to do a whole other video on implant treatment options for people missing all of their teeth.
Okay.
And so to let people kind of understand what we can do. But this is very typical.
Okay.
We'll see this kind of thing all the time. I see patients coming to see me who are 75 and they cannot wear their dentures anymore.
Okay.
And the reason is they don't have any bone support, you know.
But the beautiful thing is that you can help them.
Yeah, there are things we can do, that's for sure.
stuff.
So we can reconstruct those people. So that's bone loss. Pretty much, you know, you can expect that if the teeth are removed and nothing is put back, that bone will continue to shrink and resorb. It's a very natural process. That's why, you know, people who are wearing dentures, they have these issues where as the gums shrink, the denture gets loose. And so they go back to the doctor, and what do? They put a new lining inside.
Okay.
And the pink part that they're losing keeps being added to their denture. And over time, the denture gets bigger and bigger and thicker, and the teeth get shorter. You know, the gums get smaller and smaller and smaller, and eventually they're not able to wear their denture at all.
Okay.
And hopefully they will have come to see us before they get completely catastrophic.
Yeah.
And then, you know, because when they lose that bone and they can no longer wear their denture, that is a problem for us because we need that bone as an anchor
Right.
to help support their implants. So if they have no bone at all, it's going to be very difficult to put implants in or to do something.
So don't let it go that far.
Yeah, don't wait till the end.
No.
You know, sooner or later you're going to have to see somebody and have something done to help you wear your dentures. Like you said, your grandmother's teeth were in the drawer.
Yeah.
Right?
Yeah.
Why is that?
Yeah.
Because, you know, they got loose, she couldn't wear them anymore, she couldn't eat with them, and she felt better just leaving them in the drawer.
Absolutely,
And,
for
you
sure.
know, so we call that being a dental cripple.
Yeah.
And we see that all the time, people who cannot eat.
So I'm guessing the key then is if you know that you have pulled teeth, get in somewhere right away and make sure the bone loss isn't, like, prevent it.
Yeah.
If there's some, okay, good, but let's stop it before it gets too bad.
Yeah, absolutely.
Right on. Good stuff.